Hello, everyone, and thank you for joining today's webinar, A Roadmap for Sustainable Community Mental Health, Access, and Impact in 2026. The webinar will start in approximately 1 minute. All right, well, let's get started. Good afternoon, everyone. Thank you for joining today's webinar, hosted in partnership with one of NACCHO's Diamond Affiliate Partners, business partners, Credible Mind. My name is Jenny Bingston. I'm the manager of the Affiliate Business Partner Program at NACCHO. Today's event is being recorded and will be shared with all registrants along with the session slide deck by the end of the week. Credible Mind is committed to meeting community mental health needs head on with a powerful and yet simple to deploy platform purpose built for public health teams and friendly to public health budgets. Scalable, evidence-based, and customized to your community, Credible Mind delivers greater reach, early intervention, navigation to local programs, and data insights. Hundreds of communities rely on the platform to serve as a hub for community-wide coalitions and collaborations. The Credible Mind platform powers NACCHO's Behavioral Health 360 program. Before we begin, a few brief housekeeping notes. This session is being recorded. The recording and presentation slides will be emailed to all registrants by the end of the week. If you are joining us live, we encourage you to participate. Say hello in the chat and use the Q&A feature to submit your questions to our speaker. We'll answer as many as we can in the allotted time at the end of the presentation. Now, for introductions. NACCHO is honored to have such an experienced panel to share its insights. Allow me now to introduce our speaker and session facilitator, the esteemed Derek Van Brunt, co-founder and CEO of Credible Mind. As the CEO of Credible Mind, Derek oversees the development and evaluation of clinical and patient-centered systems implemented in over 500 settings and leads Credible Mind's growth in over 200 communities, reaching more than 60 million lives nationwide. Dr. Van Brunt is also the founder of the Healthy Communities Foundation, a nonprofit organization, and teaches health informatics at UC Berkeley's School of Public Health. Derek, over to you.
Thank you, Jenny. Very much appreciated. Hi, everyone. We've got a really important topic today, which is, our country's in a mental health crisis, and we need to figure out what to do at a local level. And we are lucky to have some experts that are doing precisely that work. I am joined by Kathleen Roberts and Vanessa Salmo. They're both with the Community Coalition Alliance, Kathleen as the CEO and Vanessa running epidemiology and evaluation. So really looking forward to an interactive session. The way we've kind of got our flow planned is that I'm going to provide a little background information just around the state of mental health in the United States and some of the tools that are available to people. And then we're just going to hear from the experts, and they're going to tell us what they're doing. And to just give you a little preview, CCA is essentially, the way I think of them at least, is kind of a coalition of local coalitions. So they see across what's going on in many different local communities and the kinds of things that are working in coalition formation and efficacy. So really lucky to have them, and Kathleen and Vanessa, delighted to see you both. I'm glad you're here. So with that, we'll go ahead and get started. And the main topics we're going to cover are first, what is this idea of population-based mental health or behavioral health? What do we mean by that? And then we're going to talk about the importance of building and sustaining coalitions at a local level, and then hear about some concrete case studies and examples. And then we want to leave you with some tools so that as you leave the session today, you've got some assets that can help you on your road, whether you've already got a coalition going or whether you're sort of trying to get one started. Um, Please feel free to put questions in the Q&A, as Jenny mentioned, because we're doing our best to make sure there's some time here to have a more interactive communication at the end. So why do we care about population behavioral health? What is it and why do we care? So let's just take a moment. We're in our nation, and for that matter, most of the rest of the world, is in a national mental health crisis. And what I mean by that is that rates of various diagnosable conditions are up and they're not really coming down very quickly. And the current system that we have is largely a reactive system of care and it's not keeping up. A different way to put it is what we're doing today doesn't work. So we need to do some new things. And the good news is we are doing some new things and they're working, as you'll hear. So here are just a couple of numbers so that everyone's on the same page. So I guess I'll start with the bad news and then we'll go to some of the good news. So I'm not going to go through all of these, but if you look at people that have early symptoms around anxiety and depression, for example, in this country right now, the average delay to getting some kind of professional assistance is 8 to 10 years. That's a long time where we could be helping people with either prevention or early intervention. And we've got a serious provider shortage in the area of behavioral health, roughly estimated at 250,000 nationally today, and is expected to go up. And the result of that is about a third of the nation, principally rural areas, but not exclusive to that, about a third of the nation lives in what we call a mental health shortage area. And which means there are no professionals there or just such a dearth that it's completely insufficient to handle the needs. So the idea that we would try and continue to use the same system as we have elevated rates of mental health challenges, and expect people to try and find care when there isn't care to be found in some areas and it's too expensive for some and all the other kinds of classic problems is simply not paying attention. The last thing I want to mention is the costs associated when people have a physical health ailment and a mental health comorbidity. The outcomes and costs are 3 to 5 times more. So for all of these reasons, this is a big problem. It's not going away unless we start thinking differently about it. Now, let's shift a little bit to some good news. It turns out that of people with mental distress, around 3 out of 4 just want to know what they can do to feel better, what we might call self-care. And this creates a tremendous opportunity. So if you think about adding prevention and early intervention along with the prevention of professional services, it's not about, of course, we're going to continue to improve and enhance our professional services. But if we can add prevention and early intervention that's evidence-based, we can help everybody with current resources that are available. And in terms of who we can help, all three of these different communities or audiences. So the residents in the communities we serve, for sure, that's the focus of the talk today. But we can also help our workforce, public health workforce in particular, has a lot of challenges right now. And we can help our patients, both inside and outside the walls of our service delivery system. So what is this population health? What does it mean? Basically, population behavioral health is just combining what we do already today on the right, depicted on the right as the idea of therapy and medication or clinical care for people with diagnosable conditions, and adding the box on the left, which is prevention, early intervention, and navigation for everyone in the community so they know where to go and provide them information that's evidence-based so that roughly 3 out of 4 can just help themselves and they never hit the professional system. And roughly 1 out of 4 will go on and need help finding clinical care. And in the process of that, we can address many different issues, including a lot of disparities and social determinants of health. So, quick snapshot. What's going on today? Let's fast forward from theory to feet on the street. What's going on? The map of the US here, all the green colored states have at least one group that's working on population behavioral health. Many states have, as many as 10. Altogether, over 200 different communities have launched a behavioral health, what's called 360 initiative. It's basically a program that uses some technology and services, meaning activities at a local level to drive engagement and drive positive outcomes around behavioral health. So we're already learning quite a bit. Health departments sit at the center or near the center in almost all of these different coalitions. And as has been mentioned, over 60 million lives are currently covered under these programs. So we're learning a lot. And I won't dwell on this, but I'll just give you two or three examples of the results that we're getting, and they're depicted over on the right. If you think about it from the individuals being served, over 90% are saying this kind of a program, evidence-based self-care information around behavioral health and navigation to local resources like 211 or finding a provider group, that those kinds of capabilities are, one, extremely useful, over 90%. Over half of people using this program are basically saying they're making positive behavior change. They're sleeping better. They're less angry. They're communicating better at work. And then if you step back from the individual and you look at it sort of 50,000 feet up, we are making tremendous system change because it turns out this program has assessments in it. People love kind of getting an assessment of, do I actually have anxiety or am I just a little bit nervous or, these days about this or that? So there are these validated scales, PHQ and GAD, et cetera, and people can take these and they do. They're very popular. And it turns out that people with lower risk levels, lower acuity, self-select and go look for self-care resources, which is wonderful for our societies because that is of immediately available, essentially no cost at that point in time. It just doesn't hit the system. And then the 1 out of 4 that generally have sort of, and then people with higher acuity, they generally go and they start looking for professional services. So it's a natural triage system, which is beneficial both to the individual and to the healthcare delivery system. So that's what's going on. Quick snapshot. So let's now shift to the role of coalitions. And we have one or two tools we want to share with you, but we thought we would take a moment and just poll you because we're constantly listening and you can see yourselves as a group here. And we're going to run two polls here. So let's put the first poll up. Here we go. So, what organizations in your community do you rely on most as a coalition partner for promoting community mental health? Now, if you're not doing anything in mental health or working in a coalition, just don't answer the question. But if you do, please drop in an answer. Short bullet, just names of organizations is helpful because then we're going to sort of roll that up and see what that looks like. I'll give you guys 15, 20 seconds to just kind of drop in some of the names of which organizations are most important to you right now. And I'll give you a little preview. We've actually run a fairly large survey around this, so we'll see what you folks write down, but we actually have some numbers we can share with you that are a little broader. Okay, let's take a look at what this is looking like. So we don't actually see the results. Is there a
Let me see if I can get the.
maybe it's good that we already ran a poll on this topic because because we do have results that we will show you.
I would need to share my screen to show the results.
I see. Is that
Yeah.
comfortable? If it is, please do so. And if not, we can share this results later. Your choice.
I can share this.
And that'll work well, Janae, because then we can run the second poll question as well. We have two questions teed up for everyone.
Can you see the screen?
Not yet.
All right, let's try it again. Sorry about that. Let's see.
Screen.
Janae, if it's not coming together, it's okay. We have, oh, there we go. All right. Well, no, we're just seeing the poll question again, not your screen. Let's
Okay.
just go forward. I think we're fine.
Hey Derek, I can share my screen. I have a word cloud.
It looks like everyone can see your screen. So I think Derek, it might
Oh, because I'm in presenter mode. Thank
be
you. Great. Okay. Unfortunately, I don't see it, so I don't see the results. But okay, everyone can take a look and see what that word cloud looks like. And unless there are any comments, let's roll this to the second poll question.
All right.
So what we want to get at now is not just who, but what are the important challenges that you're trying to address with these partners or that you would like to? So is that you're trying to reach and engage more community members, and that's why you're working with partners? You can click all that apply, by the way. Is it that you're seeking to get some partners to like apply for grant funding or for them to just directly share in program costs or other kinds of collaboration? Or just other. But what are the main things that you're looking to accomplish with community partners? And let's go ahead and give you 15 seconds to click a couple of those, and then we'll take a look at that result. Okay. I can see these results. Great. So reaching community and engaging community members is about half of you. And that makes a lot of sense because as we're going to be talking about, coalition partners can essentially extend your hands into the community and find people where they are, whether that's in schools or diversion programs or wherever. Not so much looking for grant funding sharing, not so much sharing program costs, but really focused on collaboration. Okay, well that's great. Let's move on from there and let's see how this stacks up with some polls we've already run. So one of the things we did is we ran a survey of a large number of health departments and some of the coalition partners they work with and said, who are you working with? And this is the word cloud that came back. And I suspect it looked pretty similar to some of the ones that you folks have. But what I want to call attention to is just how varied this is, right? This isn't just the health department and the hospital working together and maybe United Way. Those are very important organizations. But you look at the breadth of 988 lines, crisis lines, faith-based organizations, large employers, banks, various foundations, insurance companies, schools, so Justice Department. So we're going to talk about the opportunity here of many of the organizations that have an overlap of mission and objective to improve the overall mental health and well-being of the communities that they're in. And how we can align interests, whether that's financially or reach or other collaboration. And everyone will be obviously welcome to have a copy of these slides. The second thing that we did is this last summer, we ran a workshop at the NACCHO 360 conference, and it was very productive, and there were many people there. And what we did is we basically went through a structured process of trying to understand who are people partnering with and why. Who are the successful partners and why are they at the table? And what are they bringing? What's the value? And what are some of the methodologies? Are you using map planning? Are you using, collective impact out of Stanford? What sort of methodology are you using? And we put together this community coalition and sustainability toolkit. And that's available to you. It's basically a document. And I'm going to show you one of my favorite sections in the toolkit, which is this. It's a little bit hard to see, but what you have on the right-hand side, but the left-hand column, are the partner organizations. You'll see things like banks, chambers of commerce, United Way, hospitals, school districts, etc. But then it's why do they care about mental health and overall well-being? And what's some of the language to talk with them so that when you're inviting them, whether you're starting a coalition or adding people to a coalition, so, many people don't know that banks have reinvestment requirements and they care a lot about the productivity of the community and that it's a good place to live, as does chambers of commerce. And so you go down the line and you see what drives some of these folks. Because if one of the punchlines around successful coalition activity is not expecting people to just show up week after week, month after month, unless they can take results back, results that have been measured. So you want to have an aligned interests, you want to have some shared goals, you want to celebrate success, and then people need to take those successes back to their organizations and they need to be relevant to their organization's goals. If you can get that alignment, now it feeds on itself in a very positive way. If you don't do that, what happens typically is coalition fatigue, where a lot of well-intentioned people get tired because there's nothing they can point to, and it becomes a side activity, not central to their own organizations and their role in their organization. So this is a resource, the guide that's available to you. It's much longer than this page. There's quite a list of organizations, and people are finding it quite useful. So let's move from sort of theory. The goal was to give a little bit of background about what is population behavioral health, a little bit about this program that's out there and some of the positive results that people are getting. But let's talk to the experts. So I'm going to turn it over to Kathleen and Vanessa. And let me ask you folks to talk to us about what you folks are doing in your work.
Awesome. Well, thank you so much, Derek, for the opportunity for us to be here today. We are so excited to share out about this amazing experience we've had with working with this behavioral health platform. It has opened up so many doors and opportunities for us. It has created new partnerships with groups that we would have never even thought would be amazing partners in this work. And it really has helped us to kind of rethink what behavioral health looks like in a community setting and really focus in on that population level change. So I'm Kathleen Roberts. I'm the CEO for Community Coalition Alliance. And as Derek said, we are a coalition of coalitions. We have the opportunity to create a membership association where we can have local county level coalitions come together to brainstorm, problem solve, move past barriers and issues, but then also celebrate successes, talk about some great outcome measures for the things that they're doing, and really be able to make that movement for a collective voice. And that's what we do here at the coalition. We are that collective voice by providing that data-driven strategy to advise, advocate, strive for health and wellness across diverse communities. And what we have found with this behavioral health platform is that opportunity to really do this at a larger level. And we're so excited for this opportunity. We have that chance for all of our coalitions to come together and not only be that association membership, but also we provide technical assistance, we provide training, access to data. So we are consistent in the messaging. We understand where the data is coming at. We are able to look at those issues that are relevant across our different communities, but also those that are specific to some types of environments. And so we really work very hard to have that collaborative approach and be able to grow and expand from there. Next slide, Vanessa. And one of the things that we'd like to share with you is that we work a lot right now in the Jacksonville area, which is our largest community in our association, but we have membership across our whole Northeast region. We've got membership in the Southeast region. We really try to work with a diverse group of coalitions. Everybody has a different areas that they're in, different populations, but we have a lot of things that are similar, and that is the need for behavioral health support and resources. So this has really been able to move us forward in that. And if you want to go to that next slide, Vanessa, this just gives you a listing of our various different members that we have and who comes together to help us really work in a unified approach to addressing the issues in our communities.
Awesome. Thank you so much, Kathleen. And thank you all for allowing us to be here. I'm Vanessa Salmo, our Epidemiology and Evaluation Director, and I'm going to kind of go over what we've been doing for the last couple of years. We launched Credible Mind in the Jacksonville community in August of 2024. And since we've reached nearly 18,000 users as of the end of 2025, and we're really excited just to share more about the wide range of strategies we're using since the beginning to be able to sustain the Credible Mind platform in our community and really ensure that broad community engagement that Derek was sharing about. So first, I'm going to cover how we, look at many different funding sources. We really want to be agile and less reactive once funding sources end. Initially, we were funding Credible Mind through our local Duval opioid settlement dollars, and we've continued to kind of braid in Credible Mind into all of our funding sources and all the programs at CCA. That way, we can, ensure that we're always being able to sustain it financially. Just recently, we've started to incorporate Credible Mind into our behavioral health state block grant dollars. We've worked on an R Corp grant where we've kind of included a little bit of the costs there. Derek also just recently shared an amazing opportunity for a new grant that's coming down the pipeline for the nation called the Rural Health Transformation Grant that we're looking at as an innovative idea. So definitely we're really trying to, remain agile, use that braided funding approach as one of our main strategies for how we are sustaining Credible Mind. But also, the most important part is kind of how we're holistically integrating it into our entire organization. So we've trained all of our staff on entering resources into the platform. We've onboarded many different cohorts of student interns from our universities in the area. And initially, I'll share, sometimes they thought it was busy work at first until we got to share some of this detailed information that Derek was sharing about population health and the impact of Credible Mind on the community. So they definitely transformed their viewpoint on what they realized they were working on, really increasing those number of resources in our community. And as well as our capacity. And just wanted to share a little success story on that. By doing that and involving all of our different staff members and interns, we've been able to add over 300 community resources to our community resources database on Credible Mind. Not just for the Jacksonville area, but we know that people who live in Jacksonville maybe work in counties elsewhere or live in counties elsewhere and come to Jacksonville metro area because there's a lot of jobs in this area. So we want to make sure that they're supported also with the social services, for where they live, work, and play. So another way that we've been able to integrate Credible Mind is through our weekly webinar series called Tuesday at 2, which usually focuses on a health observance. That is, a national health observance. But every time we have a presentation from a local community partner or on a topic of interest, we are also including a slide at the end of those presentations to relate the topic area back to Credible Mind. If we're highlighting Suicide Awareness Month, we're providing that suicide prevention topic area in Credible Mind, or a practice link to Credible Mind on meditation or breathing or journaling, whatever might, assist that person. That way we're always connecting every initiative we do back to Credible Mind. And we've also gotten, local coalitions involved. We print flyers for them so that they can give them out at their own events, maybe backpack giveaways, food drives, wherever they might be. We help, increase that voice by partnering with others who are also helping us share the message. We've, integrated Credible Mind into a 3-part curriculum for high school students on substance use prevention, where we go out to the high schools and we're, delivering information on boundary setting and, all those kind of communication strategies. And those are topics in Credible Mind that we've been able to weave into that educational program so that they're not only hearing the facts, but also hearing the resources that can help them cope with anything they might be experiencing. We also have, since 2017, been implementing something called the Drug Epidemiology Network meeting, where we bring a bunch of different sectors at the table, our health departments, our first responders, they're all presenting monthly data on the drug overdose crisis. And we're presenting data on Credible Mind. We're being able to share back with them the impact of them sharing Credible Mind in their organizations. We're able to share our marketing data, and I'll share a little bit more about that in a moment. But just wanted to kind of highlight our holistic integration and how we're really able to just consistently keep Credible Mind visible, keep it continuously relevant, and integrated into the everyday fabric of Community Coalition Alliance and all the things we're doing. So this is just a slide of one of the data slides we share. Many of you are probably Credible Mind customers, but on the back end, we get de-identified anonymous data that shows us who's engaging in our platform. And this is really how we help our community partners understand that they are making an impact by sharing Credible Mind within their agencies. We also just recently launched, multiple languages, and they're helping us reach those target audiences. And another really cool thing that happened this past month, we have this meeting at the 4th Wednesday of every month. So just like last week, several of our coalition partners were sharing that they shared it with their HOSA students, the Health Occupation Students of America, and those students are now going to be peer ambassadors for Credible Mind. So, students sharing it with students. And we just launched something on our page called the Youth tab. So we'll be able to share that with you guys. So they're going to be promoting that. And we also just connected with our EMS partners who shared it with the chaplain who's going to be providing mental health support to their first responder staff. And we're tracking some of that engagement as well. So it's just really cool to see like sharing out the data and how exciting it is. And our partners are so excited about it as well. This slide kind of shows what a coalition, all the sectors are part of a coalition. And so this is kind of based on the CADCA model, if you guys are familiar with that. But I just wanted to show you this graphic because I want to go through kind of how we've reached these different groups of people. So for youth and parents, for example, we've reached them through the education program, also through our interns, and we do also present at local colleges. I just came from the college this morning presenting about how the interns can potentially engage with us and work on Credible Mind. And so I have another really cool success story that Kathleen actually got to implement in her community. Her daughter actually texted her one day during school and let her know that, one of her daughter's friends was actually having thoughts of self-harm. Kathleen was able to, immediately go and talk to the school guidance counselor and provide Credible Mind resources for the counselor, the teachers, and that student and her parents. So, it's just a way of being able to immediately engage with the community to provide them those tools and resources that they need, until they can maybe get seen by a mental health provider or even while they're being seen by their mental health provider. We also go out to local businesses. We do environmental scans at different smoke shops to see what products are being sold. And we also have connected with those smoke shop business owners, the bars, the restaurants, to be able to provide Credible Mind flyers in their shops and, in the bathrooms and all those kinds of things, just to make sure that people who are, coming to potentially purchase a product to cope with their stressors maybe have a healthier, option for coping rather than, whatever they might be purchasing there. And then we've also connected with different construction companies as well. Has been a really cool recent engagement. I'll share a flyer that we created for them as well. And then we've also just want to make sure that any business, I know Derek showed that really cool word cloud, any business is, a partner of ours. We really want to, connect with the Hispanic Chamber of Commerce coming up with our Hispanic and language that we just launched and those kind of things. We've also connected with realtors and, apartment properties. We noticed that when you're doing, showings, there's potential for, getting access to different things in the home or, a new house, a housewarming gift that can be part of like your little realtor gift. And that's kind of how some of our local realtors have created their housewarming gifts. We've also had our marketing department publish a social media toolkit on a monthly basis so that our partners don't have to go through the hoopla of creating content. They have the content created by us and we are, just helping them increase the message. I'm going to turn it over to Kathleen so she can share a little bit about our photos and our recent events.
Thank you so much, Vanessa. One of the things that's so amazing about this Credible Mind is that with these different engagements we've had, we've been able to reach so many new types of partners. And that helps us to realize, when we talk about mental health and we make it more about health, it fits in no matter where you are in that community. That sector wheel that Vanessa just showed all these different sectors. We found a way where Credible Mind fits in each and every one of those. And then now we're having other groups reaching out to us without us even going to them, which is amazing. So we are trying to find any possible way that we can get the message out there, whether we're doing a presentation, whether we're doing a training, whether we're going to events. So these are a couple of examples of large scale events. We go to events that are sometimes small, little health ones at a school or a community event, but these are two of our larger ones that we wanted to share here. So the Brave Summit is an opportunity for young people to come together, and they actually try to bring in youth from all around the counties that are in our region, and they had over 5,000 students there. And for us to be able to reach young people, as you saw that other slide that Vanessa had, our biggest users, that are at least the ones that are reporting their demographics, are coming from our teens and our young adults. So if we can get into a venue that has 5,000 kids, when we know we have the biggest chunk, 20s, whatever it was, 26% of our users coming in from that age group, that's amazing. And after that experience I had with my daughter and being able to use this platform for work in my own personal life, it's just made it even more amazing for what this work can do for our community. The second one listed here, that is the Jack's Ready, which is our safety piece. So that also is an opportunity for us to go to where all the firefighters come in with the different first responders, what are health support systems. And so when we can fit into all of that and then bring Credible Mind there, we're able to make a huge impact in how many people we're able to reach. Next slide, please, Vanessa. And so we try to go to all different kinds of places. Some places are going to be small little community events that maybe have, like 60 people show up. Others are large ones like the Brave Summit with 5,000. Here's a couple of other examples of what we do when we do go out. I want to kind of notate that one there on the bottom left. We launched this new initiative with the Jacksonville Transportation Authority. Again, when we think about different partners, this was one of those, oh my goodness, I didn't realize we were going to partner with the Transportation Authority, but they are so invested in this. And we were able to work with the local county coalition, Drug Free Duval, our HIDAS, which is the high intensity drug trafficking area, as our partner, and then the Community Coalition Alliance with JTA to do Safety on the Move, where they gave us one of their buses for free because they believe in what we do, wrapped it, and now we get to go into the community throughout Jacksonville to some of the more high need areas and provide training, technical assistance, all this information on Credible Mind. It really is a great opportunity. And then we've also been able to go to different events where you'll see there's an LG monitor there to the bottom right, and that we include, sometimes we are able to just put the website out, but the other thing we've been able to do is we video record when we're going through the website, depending on which presentation it is or which audience will be there. We can customize the different pages that we'll show. So if we're going to an event that is going to be mostly moms and talking about health nutrition, then we can go in and customize the different things, and there'll be a video playing of all these resources available. But if we're going to go into a different group, say we're going to present at a new employment fair or whatever, then we put in things that relate to work stress and coping mechanisms and all these things. Again, customizing what we show to be relevant, which shows us again how relevant this is no matter where we are. And then the other ones are more examples of our outreach events when we're going out there showing the different flyers. We do a lot of flyers, we do QR codes, we find any possible way that we can put this message in because it fits with everything we do. Next slide, please. The other amazing thing that we're able to do is every year our coalitions come together and we go up to Tallahassee, which is our capital here in Florida, to talk to our policymakers. They're the ones that can help us to really make some inroads into creating systematic wide changes. And so now that we are bringing in Credible Mind, we went and we created folders. So every single folder that we left with the legislators and their staffers had an information about Credible Mind and the amazing resources that are all available to them for free. Everything that is evidence-based, research-informed, so they can trust it. It's not like a Google search. You do a Google search and you say, I am having some issues with anxiety. They're going to say, eat some pine nuts, stand on one foot, and hop around. We don't want that kind of information. We want it to be credible. We want it to be reliable. We want it to be non-harmful. So that's why this is so important. So we've been up there being able to advocate for this, making sure that everybody knows why this is so important. And now we're able to really make a lot of headway in there where people didn't want to hear it before. But now, because we're able to talk about all these different topics, it's worked out great. And if you want to do the next one, the other way we are trying to reach out people is we tie Credible Mind, the image, the logo, the website into all the different things that we distribute. So I don't know if you can tell there, but that top left hand, that's a little brain. And so Credible Mind, that is all about the health of here in your brain and your wellness. We love that. It's a little stress ball, and our young people really love it. So it has the information, the website, so you can get in there, and it's something they're going to use. We've also included it into our gratitude journal. And then the other one, the Facts Future, is one of our prevention one, which is an RFID bracelet. So they put it near your phone and it'll take you right to the website. So it goes to the website for our project. And then we have a nice little button that is, again, for our young people, that youth landing page. So it's so much easier than having to say, oh, go to this website. No, right there, boom, easy. And there you go. So it's really exciting for all the things that we've been able to do.
Kathleen. Another thing that I want to share with all of you is in order to get a list of all these resources and what's local and what's credible in our community, what's available, we've been able to kind of shift that responsibility to the community because we don't always know what is available. A lot of times, service agencies are referring to other partners, and so they kind of have that best polls on the best resources in the community. We created the Survey Monkey link. You guys are welcome to scan it. It looks like a really easy survey so that we can gather the organization information and then CCA can enter it into Credible Mind. That's kind of the way that we were able to really create such a robust database of local resources was because we asked our coalitions, like, did they have PDFs of local resources in the community? We entered them or we had them enter into this survey. So it's just another way that it's a one slide I include in all my presentations just to kind of, ask the community to help me build that page. Because we're stronger together. And then another thing I like to do, just a quick tip on anybody, promoting Credible Mind in your community. I won't go to our page today. I won't share a live demo, but what I do want to just say is that I use a function in PowerPoint called insert screen recording. If I'm in the community and I don't have Wi-Fi, that is an option. A lot of times I do live demos of the website, but a lot of times we're working in rural communities or we just don't have Wi-Fi on site, right? So a lot of times I'm insert screen recording. It's a function in PowerPoint where I've recorded my screen going through all the tabs on Credible Mind, demoing it. I don't put sound on it. I just talk in the presentation about that video. So just kind of wanted to share that as a quick tip because sometimes it can be really hard to navigate between slides and presenting on Credible Mind and demoing those things, especially tailoring it to the community organization. I just want to give one quick example. Recently, I had a presentation for the Women's Center of Jacksonville. They're one of our crisis domestic violence shelters, and they provide a lot of women's care. They're doing professional development trainings and things for their clients. And so what I did was in my presentation, I have a couple of slides where I demo a topic area, but I always tailor that topic page to whatever the organization is. Similar to what Kathleen said earlier about, creating the demo of the domestic violence topic or the romantic relationships topic, for example, for whatever organization is relevant to them. That way they can already see that this strategy is going to help them with their ongoing activities. It's not something extra. It's just already going to cohesively work with what they're already doing. So, just something that kind of increase that barrier. Sometimes it's hard to get that readiness, from a partner to engage in your platform or, help them share the message. Just making it so easy related to what they're already doing really helps us, get that good success. Also, the last, slide of one of our tailored approach or one of our other ways that we're being successful in sharing Credible Mind is through tailored approaches. I just mentioned one of them, but I just want to share a couple of others. So we've developed some really good marketing collateral and we're, able to track those QR codes. So that way, for example, when a partner is sharing out, we have created UTM QR codes. Anne actually taught me that. But recently we purchased a platform called Rebrandly so we can track it even better. On the back end of Credible Mind, it's easy to track. Whatever, campaign you're doing, you can track. If you create that QR code for that very specific partner, you can see how successful they've personally been in sharing the message. Then, like Derek was sharing earlier, you want to make sure that the partners feel like their efforts are successful, that they're making an impact, so we can continue to reinforce that positive message. We've also expanded to additional languages. We had some additional money to spend at the end of one of our grants, and we were able to expand to Spanish, Haitian Creole, Tagalog, and Arabic. Those are four of our, biggest populations in the Jacksonville area. And then what we've started to do is do tailored outreach to organizations that will specifically reach those populations. We're also working with our coalitions and partners in the community to translate those resources. We really want to make sure that the information is tailored and it's also very relevant to the community. Another tip that I've found successful very recently when communicating with other helper agencies or that healthcare workforce has been to offer Credible Mind as a professional tool as well. It's not just for our mental health, but even as a educator, right? I'm developing curriculum, I'm developing presentations. I would rather go to Credible Mind to find something that's already been vetted as evidence-based for my PowerPoint presentation. Like if I want to include a TED Talk or a video, I'd rather go to Credible Mind to search for that professional resource compared to Googling. So I've even, kind of shifted my message sometimes, even when communicating to local partners. This can also be a tool for you to help develop your, work tools, whatever your presentations might be, and things like that. We've also added a tab on our own website, make sure that people can get to Credible Mind very easily. Another just quick success story is this is the Spanish version, but of the flyer. Credible Mind helped us translate this one actually. But we recently went to a Jack's Filipinos event, and the event was actually a film screening on historical trauma related to World War II veterans. I didn't honestly anticipate it being very mental health heavy, but it was amazing. One of the panelists was a very big influencer in our community, in the Filipino community. She's a psychologist. She was immensely impressed with Credible Mind. I just connected with a board member, the vice president, just this past week, and she is also a teacher of Tagalog, the language that Filipino people speak. So, I was able to potentially work with her as a contractor to translate. It's just so cool just to see how this is just expanding organically. It's just really cool to see that. We've also created other tailored materials for students and teachers for the mental health assessments, for hurricane preparedness. Last year we had in Florida, not 2025, but in 2024, we had 3 back-to-back hurricanes in Florida, which was very detrimental mentally to our community. Rebuilding the community was very tough. And so we just wanted to respond in real time. We provided tangible resources like blankets, clothes, and food, but we also provided the mental health component of that. And then I mentioned, communicating with our construction company recently and, kind of created this flyer to kind of target that population. We've created women's health flyers. We've created flyers for National Veteran Awareness Month, and also, of course, the holiday assessment flyer as well. So just a couple of tools that we've shared. If you guys are Credible Mind customers, you're welcome to ask your representative for access to these, tools and resources. We've shared them with the team. So thank you guys so much. This has been such a beautiful time. Can't wait to continue to answer your questions, and we'll hear from you in a moment.
Well, Vanessa, Kathleen, first of all, thank you for sharing all that experience. You guys talk really fast and you do really great work. And thank you for sharing it with everyone. It's fantastic. I just want to make an observation or two, and then we're going to open this up to questions. Feel free to put questions in the chat. A couple of you, I think, already have, and I'm gonna sort of jump the line and just ask one or two. But when I'm hearing that's so great, I love the line, "They're now coming to us," because the challenge when I'm working with coalitions around the country, one, there's forming the coalition, and then there's getting that alignment of interest. And then even if you have that, really working your way into the workflow in a community. When someone's picking up, sadly, a death certificate, and right there is a card with a QR code saying, if you're dealing with grief and loss, just click here. And, as you mentioned, schools and, high school students with ID cards, and on the back of the ID card is a QR code that takes them to information about cutting and drug use and bullying. And whether it's farmers, veterans, et cetera, it's whatever affinity group community you can think of. That is really where the power is. And I don't know if you folks are aware of this, but we have communities around the country where around 10% of the entire population of the community is actually interacting with this program over time, which is just, this is the kind of impact we need to make. If we go back to the beginning in the challenge, all of these people are not going to get help with a therapist. And we don't have enough, and there isn't enough money, but it isn't even what they want. That's kind of the point. The point is we can sort of get it all done much more efficiently. So thank you both for sharing that so much. I want to ask one or two quick follow-up questions. I know from a lot of discussions, Kathleen, that people are particularly interested in how the funding works. Here you are, you're seeing these coalitions in local areas. What's working around the funding? How do you keep it going? Just what advice do you have there for people?
Well, as far as advice, I always say try to always bring in multiple funding sources. For one, just for coalition work in general, it's always good to have different funding sources being able to support the work you do, because some things allow for some things and something else may allow for something else. But the reason for that too is what we find is with Credible Mind, you need to know about what it is to pay for the subscription. What do you need for those people? But then we also need the people to help support and add in those additional resources to help promote that we have this resource available to go out and engage with new partners. So the funding, you have to think about it more than just a platform, but all of the components that it takes to make this a reality. Because this didn't happen overnight. We didn't just turn on Credible Mind one day and then boom, we got the success. It took a lot of that work, a lot of pulling people together, engaging, getting people out there, and then also doing the hard work of getting all those resources in. So when it comes to funding, looking at different opportunities to bring that in is really critical, and looking at things not just necessarily just for mental health. This topic fits in to just about anything. So don't be hyper focused on just the topic, but look at how it can work into the workforce development, just for, staff support, assistance, data. Any of those things will fit perfectly with this.
Yeah, makes total sense. I love it. And I'm just going to ask one other question because I know there are several here in the chat, but I just want to ask one more, Vanessa, because the other thing that comes up over time, we've mentioned, measure success, celebrate success. What does success look like for you? What's most important, maybe initially and then over time, for maintaining support?
Yeah, that's a great question. So initially, I think really the success that we measured was how many presentations are we doing? Are we continuously raising the awareness? Like process measures, right? Internal measures for like, are we being successful in sharing the message? And then we also started to have people hear about the presentation and then ask for that presentation from their own organization. Maybe they attended as an attendee and they're like, can you, give me this presentation for my entire staff? So that was initially like the original ways we measured success. We're also hearing those success stories, anecdotal stories from our partners. We want to hear that they helped somebody or that somebody they know helped somebody, or I've had my friends and family use Credible Mind and they've shared that, wow, this has really helped me. And so those anecdotal things are kind of like that initial excitement of the local partners and their interest in being part of the community resources page, just how we've grown that database as well. So initially they were kind of like internal process measures. But as we grew, we began reviewing and presenting that data. As I showed you, we're seeing how our number of users is growing. We're seeing the topics expand as we're sharing out tailored flyers. We're seeing that being translated on the back end of Credible Mind. Now they're accessing some additional topic areas and maybe taking more of those assessments as well. We've had over 5,000 people take our anxiety assessment, and we're, really getting information and reliable information about our community on those assessments data. Now, what we've started to do in the most, in 2025 is I mentioned those UTM linked QR codes. So now we're paying to track any paid streaming ads, billboards, flyers, any type of campaign. We always have a unique QR code that's able to be tracked on the back end to say, are we getting, users from this type of marketing strategy? We also are sharing that back with our partners again to, reinforce that they're doing the job. They're doing a good job. Like we're actually, succeeding locally.
Yeah.
And finally, one thing that we want to in the future do is to do a more rigorous evaluation. I mean, any Credible Mind user in the country that's doing some, evaluation, we want to know like ROI measures. We want to see impact locally in our mental health indicators. I'm, of course, our epidemiology director. And so what I'm also doing is comparing our state data. For example, like monitoring the future data is a national study, or locally we have our Florida Youth Substance Abuse Survey, and that measures mental health indicators and substance use indicators. And so we're comparing that data now locally as well. So like that's kind of where we're going in terms of
That's
evaluation.
fabulous. Yeah, it's great. And and it's just so everyone knows, it's as there's so much creativity going on around what people are doing, process measures and outcome related measures, and we're capturing what's working and we're building a database of best practices around this sort of population community behavioral health approach. So we're learning together, but we're getting there. We have Eric Zimmerman, who's been monitoring the chat. And Eric, I understand we have some questions. Can you lob a few over to us?
We sure do, Derek. Thanks, and great job, everybody. And thank you to the audience as well for being interactive and posing some questions. A couple I want to send over uh, to Vanessa and Kathleen first, and then I have got a couple for you as well, Derek. A lot of curiosity about. Obviously, people are very impressed with the work you're doing and how creative and dynamic it is. People are curious to know how you getting all that done. For example, one question asks if you'd be willing to share a little bit about the organization and how much paid staff you have and whether you have volunteer support just to make all this great work happen. Maybe share a little bit what's going on behind the scenes.
Absolutely. So there's a lot of different things at play here. One is our organization, because we are a coalition of coalitions, we do have staff on our team that's our CCA members. So we've got 4 different departments, our epidemiology and evaluation. We've got our training education, programs and outreach. And then we also have a marketing team. And then, of course, there's always our finance and contracts and all of those. So within each of those, that's why it's so amazing about the Credible Mind is it fits with everything, whether we are implementing a new program. So that's what we did, started to every program that we do. We have incorporated Credible Mind slide into each of the presentations. It fits into training. So every training we do, it doesn't matter what the topic is, it relates back to Credible Mind. So we weave it in there. I have a presentation coming up here in 2 weeks at our prevention summit that's happening. And we're talking about alcohol access and Delta products and all those things. Well, you know what? There's a ton of things in Credible Mind that will fit into healthier coping mechanisms and ways to have reach out for help and all of those. So we're going to weave that into each of the topics. And then when it comes to the data pieces, like Vanessa said, I mean, we presented some of the data we can see on our back end. If we know who is reaching out for these resources, then we can tailor some of the flyers. We can tailor some of the outreach events. So it's making sure we're weaving it into every part of our organization. And then because we're a coalition of coalitions, we push this information down to those coalitions. We have some that we actually provide funding to. The way our state is set up, we're able to provide funding to those that are in our Northeast region, which covers about 20 some different counties. So we put that in as something that they can start to reach out to their communities if they're interested. If we can build that, readiness for them to have this resource there, like we've done in Jacksonville, that's going to be our next step to push it out. And then we have got other members who are not receiving funding from us, but they're still part of all the different meetings and trainings that we do. So they're starting to have those conversations. If we're able to get them out there at that local level, we can then expand from where we've been in to across our state. So yes, it takes a lot of people, a lot of moving parts.
I think that's great. I think you kind of anticipated my second question,
I add
which
one
is
quick thing?
hang on, Vanessa. So your
Okay, sorry.
partners show up. In other words, they might have a table at one of your events. You're creating the umbrella, but they're showing up as well. I'm going to move us along because we've got 2 minutes left and just an unbelievable number of questions, if you don't mind. Derek, if you don't mind, I'm going to combine a couple. There's one here about social determinants of health and what about person and situation. I'm just going to simply say yes is the answer to that. Resources around SDOH are a big part of what can be featured on this kind of a platform. Very specifically, though, there's a lot of curiosity about how do you do that, Derek? How do you actually find and connect to the local resources to make this come together?
Yeah.
Could you answer that from a Credible Mind perspective?
Let me give it just a very quick answer given the timing, which is there's something called sort of there are 2 responses to this. One is the topics that are covered, and when you finish an assessment, what's in the reports that you get, so that we take these kinds of topics on, right? We're not just staying strictly in like diagnosable conditions. It's much, much broader than that. But the second is built into this platform is what's called contextual linking. And as Kathleen and Vanessa mentioned, they've already indexed over 400 local resources. So what's happening is as people navigate with this platform, they're automatically finding help with housing and and financial security and all the kinds of things that we're trying to address. Because a lot of times people just can't find things. So what this does is it becomes a little bit of a clearinghouse.
That's great. And one maybe wrap up, I'll throw it out to whoever wants to take this jump ball. There's some folks in this call who are just now beginning to get started to implement in their own communities this particular platform. And they ask, did this catch on quickly? Did it spread? You know, they're in a rural area. What's one or two things in a rural area you can do just to get the ball rolling? Anybody have a great idea for this particular participant?
I'll throw a one-liner out, which is just get the local media involved. Now, when I say local media, it could be a little rag magazine that is in the area or local news station or anything. But it's wonderful the synergy you can get because they care. It is newsworthy. It's the community investing in itself. It gets tremendous attention. But Kathleen, Vanessa, anything to add?
You want to go, Vanessa? You can. Okay. Well, one thing I would say is we see this with many of our members in their rural communities, there are not a lot of resources built in to that local community. And if, we look back at some of the data, about 3 out of 4 are trying to find that self-help will help alleviate some of those issues. If we can at least bring those self-help topics that are trusted, they're, evidence-based, research informed, then we're able to help those that are needing the help, that are looking for help, that can't find them locally because they just don't have those resources. At least this is a good interim until we can connect them to a physical resource in their local area or close by at least.
That's great.
Yeah.
Back to you, Derek.
Well, I just wanted to let everyone know where they could find more information. Sorry, send us if you put your question in the chat, we're going to get it. Let us know your name. We'll get back to you with that. If you're interested in learning more, whether you have this program and you're just here to learn about the successes or whether you're interested in learning more, you can do the old-fashioned, send an email over on the left there to Scott, who's on our team, or give him a call. There is a QR code in the middle. We love QR codes. It'll take you right to a page where you can tell us a little about yourself. Some of the things we can do, we can share materials like that sustainability toolkit and coalition partners, but we can also meet with you. We can sort of take you through what the program looks like, and you tell us about your environment, and we'll want to learn more and tell you how it might fit in and some of the partners that we might pull. And finally, good old NACCHO 360 is coming up, and we'll be there, and we're going to be having workshops and meetings, and I hope you come join the NACCHO and Credible Mind team there as well. So with that, Kathleen, Vanessa, thank you so much, and Jenny and Eric, and hope everyone has a great rest of the week.
Thank you so much. We appreciate it. Bye.
So many great questions, so little time. Many thanks to the Credible Mind team for sharing their expertise time today. And thank you everybody for joining us. Before we close, I'd like to thank Credible Mind again, a NACCHO Diamond Level partner, for sponsoring this session. Remember that the recording and slides will be sent to all registrants by the end of the week. Have a wonderful afternoon, everybody.
Bye, Jenny.
Bye-bye.